I'm delighted to be at the conference today in Kiowa as we talked about a few things. First of all, we highlighted the latest updates from the American Diabetes Association. The new guidelines really put a strong emphasis of the role of primary care in the management of diabetes. So we highlighted three big topics. First of all, we talked about the role of lifestyle, specifically nutritional plans as it is involved in managing diabetes, intermittent fasting or time-restricted eating. We talked about best ways to implement it and gave some protocols that we could use. Secondly, we talked about the role of GLP-1s. In fact, GLP-1s seem to be everywhere today, but we kind of talked about best practices as it relates to glycemic and extraglycemic indications. And then finally, we talked about something relatively new in primary care is identifying people with type 1 diabetes before they become hyperglycemic, and know that we can actually, in primary care, screen people for autoantibodies and actually get them to interventions that can potentially delay the onset of type 1 diabetes and avoid complications. We used cases to give each of these examples and had lots of opportunity for discussion.